from the station that's on your side. This is Channel 7 News Daybreak.
The time now is 6:18. As a person enters their late 20s, they have reached their peak bone mass, which means you no longer gain bone density. Why is this important? Well, joining us this morning is Baptist Health's Dr. Martha Rueda with Sherwood Family Medical Center to explain. Good morning to you once again. Thanks for being here.
Thank you.
Let's start right off with what exactly is osteoporosis.
Osteoporosis means that your bone or it's a disease that makes your bones weak or fragile. When a bone is fragile, obviously the risk of fracture increases. People who have osteoporosis, they do not have any symptoms. They are asymptomatic.
So you're walking around and you don't feel anything.
You don't know.
Yes.
And that is the problem until you get the fracture. And that is the problem.
And that's when doctors start to see them. So what are our risk factors for osteoporosis?
We have a lot of risk factors. We have, for example, you are a smoker, you are a drinker, you have a family history of osteoporosis, you have a relative who had osteoporosis or have a fracture after 50 years old, you race, you are white or Asian, you have more risk to develop osteoporosis. Also your age, the older we get, more risk too. The way that we eat, you don't do exercise, and your hormones. Men who have low testosterone, they have risk to develop osteoporosis too. Female who have estrogens low because you are in menopause. Because for some reason you have hysterectomy or oophorectomy, that means they remove your ovaries, so you get that risk too.
How common is osteoporosis?
Very common.
And more common in women, right?
It's more common in women than men, unfortunately. And also you can get osteoporosis in any age. But we see more people after 40s having that problem.
So how can we prevent osteoporosis and weak bones?
So we can prevent improving our risk factor. If you are a smoker, stop smoking. If you are a drinker, stop drinking. Take a good diet. Exercise is very important. Walk every day, 30 minutes. Take calcium, vitamin D supplementation, but be careful. You need to be sure that you don't have any contraindication to take calcium supplementation.
Okay, and if you do have osteoporosis, you do have a fall, a broken bone, what are the ways that you treat this?
We try to prevent before people supposed to have we recommend bone densities. It's a test that allows people or physicians to diagnose if your bones are good, or you are a little fragile like osteopenia, or definitely you have osteoporosis. If you have osteoporosis, before we started, we recommend exercise, the vitamin D that I said before, but actually at that moment we started treatment for osteoporosis.
And how do you test for bone density?
The bone density.
Yeah.
There is a test that we do in our annual exam or physical exam, and we check.
Not painful, easy to do?
No, nothing. It's like an X-ray, so it's not a big deal.
Yeah.
You sit down or you lay down actually for a few seconds, and that's it.
And it's worth getting that done because it could prevent a broken bone, which is going to keep you off your feet for
we don't want fractures.
Right,
no.
Right. Okay.
Because it's a lot of complications after you get a fracture. You never know what it's going to be at the end.
Okay, it's important to get that annual exam to check for bone density, especially once you reach a certain age, and especially for women. Dr. Martha Rueda with Sherwood Family Medical Center, as always, thanks so much for being here. If you have a question, you can call 1-888-BAPTIST.